Hi everyone, I am Shayne, Lisette, and Porras, and my thesis advisor is Engineer Harrison S. Cabrera, and I will be presenting to you my thesis entitled In Silico Pharmacokinetics and Molecular Docking Studies of Bioactive Ligands Against SARS-CoV-2 Essential Proteins. For the background of the study, coronaviruses are a large family of common viruses which are found in humans and animals. Many cases of the common colds are due to coronavirus, which have caused two large-scale outbreaks in the past 2 decades, which are the Severe Acute Respiratory Syndrome virus or SARS virus in 2002 and the Middle East Respiratory Syndrome or MERS virus in 2012. It's generally been considered that these coronaviruses could cause future disease outbreaks because they are known to be able to evolve within animals and jump to humans and find an intermediate host. COVID-19 is an example of this, which is believed to have spread from bats to humans in local seafood market in Wuhan, China during 2019. And its causative agent is Severe Acute Respiratory Syndrome Coronavirus 2 or SARS-CoV-2. For the global update, as of July 12 to July 18, 2021, the total number of new cases recorded worldwide was over 3.4 million and up to 12% from the previous week. In this study, FDA-approved drugs with its specific targeted essential protein of SARS-CoV-2 has been used as basis in determining its similar compounds to provide an alternative treatment against COVID-19. This research focuses on top-scored similar compounds of prazosin, lopinavir, cobicistat, and remdesivir that targeted NSP3, NSP15, N protein, and NSP12 respectively. Our objectives are to look for an antiviral strategy for treatment of COVID-19 as an alternative to vaccine, in which it is not injected, and a drug medicine that can be in form of pills, liquid, an inhaled powder, or intravenous solution that fights against flu viruses in our body. Also, to perform virtual screening of compounds computationally similar to reference FDA-approved COVID-19 antivirals from a database of experimental and investigational drugs, and to compute physicochemical descriptors and predict ADME parameters and pharmacokinetic properties of the resulting molecules to support the discovery of drug derivatives. And last, to determine the molecules from the ligand dataset with the highest binding energies. Here is the overview of the methodology. First is the retrieval of reference compound. Here, the FDA-approved drug, the lopinavir, were carefully obtained as bioactive ligand through the National Center for Biotechnology Information website, and the top-scored drug for each protein target was used as reference drug. From this, SDF form of each reference drug were obtained from PubChem and converted into simplified molecular input line entry system, or also known as SMILES. The SMILES was placed in Swiss Similarity web server to look for other similar compounds, and the method was a combination of FP2 fingerprints, electroshape, spectrophores, shape IT in ChemBL bioactive compounds. Next is analyzing the pharmacokinetics of each similar compounds. Here, the obtained SMILES from Swiss ADME is copied in Molinspiration web server, and I determined first the molecular property and bioactivity scores of the compound to investigate it further. The pharmacokinetic analysis using Molinspiration are molecular properties and bioactivity scores. The bioactivity scores of each compounds are G-protein coupled receptor or GPCR ligand, ion channel modulator, kinase inhibitor, nuclear receptor ligand, protease inhibitor, and enzyme inhibitor, while the molecular properties are the total polar surface area or TPSA and molecular volume, which can be obtained in Mol-Inspiration web server. The bioactivity scores are significant to exhibit considerable biological activities of the drug candidates, and moreover, ADMET properties, in which the most important part of drug discovery was also determined through another in silico screening web server, the PKCSM. Here, we can see the ADMET properties value obtained in PKCSM web server. While I also use the Pharmacokinetic Analysis using SwissADME web server. SwissADME web server is a web tool that analyzes or evaluates the pharmacokinetic, drug likeness, and medicinal chemistry friendliness of small molecules. Here, I considered also the bioavailability radar and boiled egg method for a rapid appraisal of drug likeness to easily screen the methods. So the SDF file of each compounds are uploaded in the SwissADME, and I click the run button, then the results appeared with all the values for the molecule. And here you can see the pink area. It is the bioavailability radar, represents the optimal range for each properties. And here are the optimal ranges that should be followed to have a good quality of candidate antiviral agent to treat COVID-19. So here's the results. The top scored compounds from obtaining the similar compounds of our reference drugs were analyzed the results of each property from Mol-Inspiration web server. So I considered Lipinski's rule of 5 and the Weber's rule to predict the bioavailability of a drug. The principles are based on a study of compounds with different physicochemical properties. And from the table, drugs that were over 5 in log P were already disqualified as a drug candidate and should not be an orally active drug if it violated more than one criterion. So the values for hydrogen bond acceptors, hydrogen bond donors, the number of rotatable bonds, and TPSA should be less than or equal to 10, 5, 10, and 140 respectively. So drug that only has one or no violations are underlined on this table. You can see that these underlined drugs are considered as a good quality or good drug candidate. So here's the bioactivity scores that were analyzed through various properties such as GPCR ligand, ion channel modulator, kinase inhibitor, nuclear receptor ligand, protease inhibitor, and enzyme inhibitor. Each bioactivity properties are interpreted as active if the score is greater than 0, and moderately active if the score is between -5 and 0, while it is inactive if the score is beyond -5. So from this table, it is found out that almost all of the drugs are in active condition and moderately active. However, among the other enzymes, all of the compounds had higher activity towards GPCR ligand with active bioactivity scores. So for the boiled egg analysis, boiled egg is another feature of SwissADME that can easily shows the compound's ability of a drug. So boiled egg is considered as an accurate model to predict the compound through its lipophilicity and polarity computation. So the boiled egg model provides a fast, simple, easily reproducible, and statistically unparalleled robust technique for predicting the passive gastrointestinal absorption and brain access of small compounds that can be used in drug discovery and development. So in this figure, it shows that the boiled egg results of the top 10 similar compounds for cobicistat. We can see that the legends given in the figure that the yolk of the egg in yellow color represent the blood-brain barrier of the BBB, and it means that if the molecule is located in the yolk of the boiled egg, it means that it can passively permeate through BBB. And BBB prevents most drugs to enter the brain and makes it difficult to develop new treatments for brain diseases. It has a physical barrier and biochemical barrier comprising of enzymatic activities and active efflux. While if there is a molecule present in the boiled egg white area, it was predicted that it can passively absorb by the gastrointestinal tract. The color blue circle is the PGP plus or the P-glycoprotein, and it predicts the molecule is effluated from the central nervous system by the glycoprotein, and it is vice versa for the red circle or the PGP negative. So here, for the cobicistat, there is no molecules in the figure, so it means that the drug is poorly absorbed in the body. On the other hand, here's the result for lopinavir. We can see that molecules 5 and 7, which are the ChemBl33539 and ChemBl33498 respectively, are outside the egg, meaning it don't permeates BBB and HIA, but all other molecules or the rest of the molecules are effluated from the CNS by the P-glycoprotein. For molecular docking analysis results, so the drugs were screened carefully through pharmacokinetics analysis and ADMET properties. From this, few compounds of each drug were analyzed its protein-ligand interaction. The highest scoring medication for each target is underlined. It is discovered that the majority of anticipated binding affinities are moderate, ranging from high to low micromolar affinities, with scores higher than negative 6.8 kcal over mole correspond to binding affinities more than 10 microm, while scores lower than negative 8.2 kcal over mole correspond to ensemble submicromolar affinities. It is identified that for NSP15 protein, ChemBl2261608, ChemBl347802, ChemBl1084038, and ChemBl223845 showed the most promising drug results with scores of negative 8.011, negative 9.069, negative 7.612, and negative 8.022 respectively. So in conclusion, this study provides advantageous comprehension in drug discovery through virtually screening compounds computationally similar to reference FDA-approved COVID-19 antivirals from the database of experimental and investigational drugs. Also, we were able to analyze its physicochemical descriptors, pharmacokinetic properties, and to predict the ADMET parameters that resulted to molecules that support the innovation of the drug derivatives. Moreover, we also obtained the highest binding energies from the screen compound through molecular docking analysis. So it was concluded that the top scored similar compounds of drugs, which are the Compounds of the reference drugs lopinavir and the remdesivir obtained good results as orally transmitted drug and can target the spike and NSP5 essential proteins of SARS-CoV-2. Hence, these results can be further modified by the future researchers and can lead to the advancement of drug discovery to save more lives. Thank you.